Hello, everyone. Welcome to Lump Basics. We are now on episode 34. Let's start with Horary points, and let's welcome Sardino Pinheiro from Legazpi, Certified Associate Acupuncturist. Good afternoon, Sardino.
Good afternoon, Doc. Good afternoon po sa lahat. Now, we continue with the lump basics sa Horary points. The organ clock. So we have the organ clock, use of maximum and minimum function, energy times for diagnosis. So we have the yin time and the yang time. Okay. Horary points or points used to the hour. Each meridian has its own 5 element points. These are the points that communicate with organs outside it. For instance, the lung meridian has a fire point, earth point, metal point, water point, and wood point. Through its fire point, the lung meridian receives energy from organs of the fire element, the heart and the small intestine. Through the water point, it could send water to the kidneys and so on. One of these 5 element point is always its own element point. For the lung meridian, this is its metal point, yung lung A. This point can be tonified or sedated, and it would receive or send energy to the organ on the opposite side of the organ clock. It would tonify or sedate 100% its own polarity. In this case, it is lung yin. The opposite organ, however, would be of the opposite polarity. The urinary bladder is opposite the lung, and it is a yang organ. The energy that is lost or gained in this organ would be its own house energy. If I want you, sabi ng author, to imagine a fire burning at the center of a room, you would need some water to put out that fire. Imagine you are holding a hose to spray water at the fire. Now and at all times, the state of the fire would depend on the amount of water that comes out of this hose. If the water comes out with a gush, it will put out the fire in seconds. If the water coming out of the hose is minimal, only a trickle and not even reaching the fire, then the fire would grow without any control. The ideal situation would be to have a steady stream of water just enough to hold the fire in control so that it does not spread and not to extinguish it. This is the idea of control. It is not to destroy and not to let the fire grow out of control. So here we could observe the arrows. We need to tonify the lungs by using the lung 8. Okay? And this, sa illustration naman na ito, kailangan natin ma-reduce ang lung energy. So we use lung 8 to sedate para lumakas naman yung urinary bladder. In this tonification is performed at the peak energy time of an organ. The energy would be very strong, equal to about 7 normal treatment sessions. If the Horary point was sedated at the least energy time, it would again have a very strong effect. This is another effective way to tonify or sedate the house energy of an organ. Generally, in tonification, we need a source from where the energy can be taken. Not all organs have energy to give away. If the mother organ is already deficient and is in no position to give energy, then we need to look for another source. It may well be that the organ on the opposite end of the clock could have some to spare. The other important factor is that the opposite organ is always the opposite polarity. If the patient has many yin deficiencies, we could now take energy away from a yang organ, but convert this energy into yin. As this energy flow is on the superficial energy circulation, that is the energy flow from a superficial yang meridian to a superficial yin meridian, and from exterior yang surface to an exterior yin surface, changing the environment makes it possible to change the polarity. Since we do a lot of balancing of energies, we need many direct route between meridians and many different connections. When sending energy from one to another meridian, we always prefer a direct route, as more stops there are on the way, the more will be the energy loss.
Okay, thank you very much, Sir Dino.
We
will now proceed to the next topic. Points that influence energy. The quality of energy. Okay, we now come to the cream of the acupuncture therapy system. Points that can make a profound difference in the actual energy status of the organs. If diagnosed and treated correctly, almost anything is possible to change and cure, provided the patient also takes part in the balancing process by changing some aspects of their diet and lifestyle as required. There are many groups of energy balancing points. Some help improve the quality of energy, some help to increase or decrease quantity of energy. Quality of yin is to calm and cool, whereas yang activates the function. The points that improve yin or yang aspect of energy do not necessarily increase the quantity of energy level. There are points that actually increase or decrease the amount of energy in an organ. Although it is possible to warm a point with moxibustion, what we usually do with needles is to send energy from one to another organ or meridian. Acupuncture works on the meridian system, which is a great motorway in our body, through which energy is continuously flowing. These meridians connect various organ systems of the body. If there is more energy in one organ and less energy in another, this means that there is a block in energy flow. There are points on each meridian that connect with other specific meridians, which could be used to send or receive energy from one meridian to another. If the point sends energy away from a meridian, it is called a sedation or dispersion point. If it receives energy from a meridian, it is called a tonification point. So we shall now discuss the network system between the organs. So we will have two big topics: points that influence the quality of energy, which are the front mu and back shu points, and points that influence the quantity of energy flow: the luo connecting and yuan source points, the organ clock, of which Sir Dino has discussed the Horary points, and as well as the exit and entry points, the mother-son cycle, which are the tonification and sedation points, controlling cycle, the last two of the 5 element points, and extra channels, confluent points and common points. The energy balancing points are listed in order of hierarchy. These are points that could influence the yin or yang nature of the organs and also send energy from one organ to the other. Through these points, one can send energy from an excess to a deficient area, thus balancing two areas. We can also use more than one energy balancing point in one treatment. So tomorrow we shall discuss the locations and uses of these points. Thank you very much for listening. Up next is Sir Dino Pinheiro for needling techniques. Good afternoon, sir.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with the lump basics, the needling techniques. Moxa does cause smoke and smell. It is a good idea to have an extractor fan fitted in the room where one intends to do moxa therapy. It will clear the smoke instantly. Nothing will clear the smell though. One can open the windows to air the room between patients. For those who dislike the smoke and smell of burning moxa, there is also a smokeless moxa. Note, moxa is contraindicated in conditions with heat or fever. So, yan po yung illustration ng moxa cigar. Okay? With different techniques of application. Like a long cigar, moxa cigar can be lit and used to warm points, lines, or areas. Easy to use and more acceptable to the patients than moxa left on the skin. It is used for the following treatment. First, we have moxa, a point with sparrow pecking method. This name comes from the maneuver. Go close to the point with moxa cigar and pull back after 2 or 3 seconds, repeating it until the heat gets uncomfortable for the patients. One important thing to remember when performing moxibustion with a cigar is never to hold the moxa cigar on a point without moving. Always move the cigar, either pecking or moving around in circles or drawing lines so that the skin does not get too hot and cause a blister, but rather the heat penetrates deeper. The sparrow pecking method is used on point spleen 1 for slow bleeding symptoms and on UB67 to turn a malpositioned fetus in late pregnancy. Moxa on area or line with warming method. Light a moxa cigar, always trim it flat before reusing. If this is not done, it will have a conical shape which might fall off while burning. And fill an area or an imaginary line, imaginary circle with strokes. You should do this until the worm moves deep into the organ. So we have here an illustration ng REN 12. The gray dot in the figure is point REN 12. The area around should be warmed with moxa. While we have at the end of the treatment is a larger warm area around the acupuncture point, and the heat travels deep into this area. The warming method is used on point REN 12 in patients with overeating disorder or alcohol addiction, and on point REN 3 in dysmenorrhea and infertility. It is used to warm the hands on pericardium 8 and on the feet on kidney 1. Okay po, thank you for listening.
Thank you very much, Sir Dino. Then we discuss treatment and disease prevention principles. Part 4. So these are considered to be the pathogens of Chinese medicine, which means that these are the ones externally that can cause diseases. So first is wind, so something that moves around the body. And if you ask the patient where the pain is, it's hard to pinpoint. There will be tremors, so this is very wind, and spasms. Another pathogen is cold, which causes pain, and the effect is it contracts and slows down the qi. Then summer heat, it creates heat in the body, and it causes exhaustion and heat stroke. Damp makes the limbs feel heavy, the joints achy, accumulation to tumors. Dry causes dryness, cracked skin, and lips. So there will be dehydration and dry cough. Fire is another pathogen, which causes excess heat and redness and thirst, plus psychological issues. Infections, wenping. So this is for warm diseases like bacteria and viruses. And then we also have to teach or make our patients perform some TCM habits, which we hope that they will follow to the letter. No cold drinks and foods, no sitting on cold surfaces, and always protect the low back, and eat or sip lots of bone broth. Okay. Then we have the basic treatment principles in Chinese medicine. So we harmonize, we also purge, we tonify, clear the heat, we warm the patient, we nourish, we induce sweat, we promote and induce vomiting. So let's talk about harmonizing. So this is regulating between liver and spleen, stomach and large intestine, stomach and gallbladder, Chong and Ren, Chong and Du. So we need to differentiate excess and deficiency and the degree of disease. Then we go to purging. We do purging for excess conditions only, and we use very strong aggressive method. We use cold herbs and bleeding method for internal heat, like constipation and high fever. We use warm herbs for excess cold, like middle jiao stagnation, indigestion. Do not use purging for bladder infection, and purging should never be used for pregnancy. Next, we tonify. We strengthen the qi using acupuncture and herbs or tuina. Do not over-tonify. Take breaks once in a while. Next, we have clear heat. Clearing heat is to relieve internal heat from organs. Cool down, dry the dampness, cool the blood, and promote body fluids. And again, to clear heat, you need to differentiate between excess and deficiency. So here is a table that will somehow simplify the differences between deficiency and excess. So a deficiency condition will usually be long and chronic, while excess is short or acute. And the patient looks weak in deficiency, fatigued, and the voice is slow and weak. And this patient likes massage so much, and the pulse is weak and thin. For excess, the energy is strong, but the patient's mind is agitated, the voice is loud and strong, and the patient dislikes touch, and the pulse is full and forceful. Thank you very much for your attention. Okay, next we have once again Sir Dino to talk about the Zang-fu organs.
Okay, we continue with small intestine functions. Functions of small intestine. Small intestine receives grains and water that had been decomposed by stomach and spleen and divides pure from impure. Also, the small intestine transforms food fodder and absorbs nutrients for the body. Clear aspects are passed on to the spleen and sent to the lungs. Impure and turbid parts are passed on by small intestine. Waste is passed on to the large intestine, and waste fluids are passed on to the bladder. Small intestine relies on kidney yang to fulfill its function. Heart stands in interior-exterior relationship with small intestine. Relationship between the heart and small intestine can also be transferred to the mental level. Heart houses the spirit. Small intestine divides pure from impure and helps the spirit in its discernment of important and unimportant. Small intestine qi aids clear thinking. Small intestine days are days on which we clean out our house and let go of unnecessary objects. Small intestine disorders are caused by spleen yang deficiency, kidney yang deficiency, or by heart fire that spreads to small intestine. Small intestine relationships. So, small intestine passes waste fluids onto the bladder. Small intestine passes waste onto the large intestine. Sa small intestine and the heart stands in interior-exterior relationship with small intestine. Relationship between heart and small intestine can also be transferred to the mental level. Heart houses the spirit. Small intestine divides pure from impure and helps the spirit in its discernment of important and unimportant. Heart fire on the physical level can move downward and affect the small intestine. Small intestine relies on kidney yang to fulfill its function. Next, we have small intestine pathology. Excess patterns like stagnation of small intestine qi, cold in small intestine, and heat in small intestine. Stagnation of small intestine qi. It originates in combination with liver qi stagnation or spleen yang deficiency. Cardinal symptoms, there is a feeling of tension in the lower abdomen. There is a stabbing pain in the middle or lower abdomen, and rumbling intestine and gas. Appears, we have cold in the small intestine. This one appears in combination with spleen yang deficiency. Cardinal symptoms, there is a rumbling intestine, pain in the lower abdomen, improving with heat, diarrhea with cold sensation. Heat in the small intestine originates in combination with heart fire. Sa cardinal symptoms, there is mental restlessness, tongue, ulcers, pain in the lower abdomen, improving with cold, difficult urination with burning pain, and blood in urine. Thank you for your attention.
Thank you very much, Sir Dino. Okay, so far we have discussed 5 topics. Let's now go to the earth element. Okay, last time we discussed the difference between yang warrior and yin warrior. So for yang warrior, there is often a yin deficiency, and therefore yang tends to rise. The treatment is mainly to tonify the yin. So we use Ren 12, which is the front move of the stomach, tonifies the yin. We also use spleen 4, which is the luo connecting point, and sedation of the yuan source point, which is stomach 42. This is done even when there are no symptoms as a prevention, so the yang will not rise. Stomach 43, a wood point, will tonify the yin. Do 20, a tranquilizing point, but it also gives some detachment from the situation. So for the yang warrior, we try to recommend some milk products and some protein meals to make the stomach more yin. And pericardium 6 and liver 1. PC6 is distal point of the upper abdomen. Liver 1 is a house element point and tonifies liver yin, which will send more yin to the stomach. Now let's talk about the yin warrior. This is often a qi deficiency, so doing is difficult. Bladder 20, the Bakshu point of the spleen, tonifies the function of the spleen. Stomach 36, the earth point or house element point, strengthens the yang. Bladder 15, SI3, Bakshu point of the heart is bladder 15 and tonification point of the small intestine, SI3. We use this to tonify the mother of the earth. And then we recommend whole grains and unrefined food, no refined sweets and carbohydrates. They might find it difficult to comply. Light but regular physical exercise like walking and swimming, being active, makes it easier to do things and to have more self-discipline. Okay, so now let's go to compulsive obsessive neurosis. Both yin and yang aspects of the spleen and stomach have to be tonified. Liver 13 plus bladder 20, these are the move front and Bakshu points of the spleen. Ren 12 and bladder 21, move front and Bakshu points of the stomach. This can be given on alternate treatments. Moxa on Ren 12 is very good. Stomach 36 and spleen 3, both house element points, can be used to tonify yin and yang. 220 and other tranquilizing points will help to detach from the worry. Warm cooked foods, light and easy to digest, and warm drinks. Tasks involving response prevention. These are exercises the patient does with or without the therapist, where the patient is expected to prevent themselves carrying out their compulsive behaviors. Thank you very much for your attention. We now proceed to channel theory or meridian theory, and this will be presented by Sardino.
Okay, we continue with the meridian theory, kidney channel of foot tai yin 4. Xiao yin kidney channel. Channel changes and physiological significance. Observation of areas related to Xiao yin kidney. The area along the channel between kidney 3 and kidney 7 will often present with dryness in cases of kidney yin deficiency. The skin in the area may also appear slightly scaly and a bit red in these cases. Palpation of these areas related to Xiao yin kidney. Palpation of the pulse at kidney 3 can give an impression of the condition of kidney qi. In cases kidney qi deficiency, the pulse at kidney 3 will most often be deep and fine. The kidney 3 pulse is also very helpful in diagnosing the cause of high blood pressure. Often, high blood pressure is caused by underlying deficiency of kidney qi, leading to a hyperactive yang. In cases where deficiency predominates, a weak fine pulse at kidney 3 can verify this diagnosis. The use of strong heat clearing and downward directing herbs might actually lead to a rise in blood pressure. In such cases, the treatment principle should therefore focus instead on strengthening the kidney. Tooth pain may also be caused by a similar kidney qi deficiency. In these cases, the deep fine pulse at kidney 3 might be combined with tenderness in the area. A strong pulsing at kidney 16 indicates a combination of kidney deficiency and strong pathogens. In such cases, the pathogen might be water, qi stagnation, or even blood stasis. Palpating the channel, pressing the points, and feeling the body surface. Tenderness or small painful nodules in the area around kidney 4 and kidney 5 is often found in the presence of kidney or urinary stones. This may also indicate urinary tract infection or prostatitis. The tenderness in this area or around kidney 3 may also indicate general kidney deficiency. So we have here the kidney points. Kidney 16, okay, about 5 June. Another, we have kidney 4. Nasa may between the medial malleolus lang po. Tenderness around kidney 6 indicates swelling or inflammation in the throat or larynx. Recall that kidney 6 is the meeting point of yin-qiao vessels which travel through the throat. Because the yin-qiao is also responsible for the integrating muscle movement among multiple channel sinews, this area may also show small nodules in chronic conditions affecting multiple channels on the leg. So thank you po for your attention.
Thank you po, Sir Dino. We now come to the last topic for today. We are still on chest painful obstruction, identification of patterns and treatment. So we have here a case history, 56-year-old woman complaining of palpitations with dull ache in the chest that extend upwards to the jaw and downwards to the left arm. She felt cold and sweaty during an attack. These attacks were becoming more frequent. She also complained of great tiredness, lack of appetite, feeling of heaviness, dizziness, and blurred vision. She also suffered from expectoration of profuse white phlegm. Pulse was slippery, tongue very sticky yellow coating. This is a clear example of chest pain due to phlegm. Manifestations of phlegm are dizziness, blurred vision, expectoration of phlegm, feeling of heaviness, slippery pulse, and a sticky tongue coating. Phlegm is obviously caused by spleen qi deficiency, which accounts for the great tiredness and lack of appetite. This lady was treated with acupuncture only. Treatment was initially aimed at dealing with the manifestation first, that is, resolving phlegm, and later with the root, tonifying the spleen qi. Main points used to resolve phlegm from the chest: stomach 40, lung 5, spleen 6, pericardium 5, pericardium 4, Ren 17, Ren 9 with even method, Ren 12 with reinforcing method. The main points used to tonify the spleen were as follows: stomach 36, spleen 3, bladder 20, bladder 21, using reinforcing method. We have here another case history, 36-year-old woman who had had an attack of viral pericarditis the previous year. At that time, she had chest pain, felt very weak, was sweating, and had a temperature. Since then, she had been feeling very tired, dizzy at times, and her memory was poor. Appetite was not very good, with constant desire to lie down. At times, her mouth felt quite dry, and she had a tendency to constipation. Pulse was rapid and slippery, tongue red with a sticky yellow coating, and a stomach-type crack in the midline. This is a condition of combined deficiency and excess. There is some deficiency of qi and blood, so there is tiredness, desire to lie down, poor appetite, poor memory, while the excess is characterized by phlegm, slippery pulse and sticky tongue coating, and heat, dry mouth, constipation, red tongue with yellow tongue coating, and rapid pulse. Although the condition is one of both deficiency and excess, it is better to resolve phlegm and clear heat before we tonify the qi and blood. Especially with herbal medicine, tonifying qi and blood in the presence of phlegm and heat may aggravate the condition. This is because most qi and blood tonics are sticky, therefore they tend to aggravate phlegm, and warm in nature, so they tend to aggravate heat. After a few weeks of treatment aimed at resolving phlegm and clearing heat, attention should be diverted to tonify qi and blood. Thank you very much, everyone, for joining us today, and hope to see you next time. Thank you po.